It was a pleasure to talk about the applications of artificial intelligence to chest imaging. We are already seeing the benefits that we can experience from a thoughtful, rigorous approach to abstracting all the information that's available on a chest imaging study and correlating it with important clinical outcomes. For example, to determine whether a nodule is present on a CT scan and whether that nodule is likely or not likely to be malignant is a very important application that is being tested and is being evaluated for implementation very widely. The benefit of this approach is that it can provide an expert assessment to all patients who have chest CT scans, whether or not they live close or far away from an expert who would routinely be evaluating these scans in a large urban medical center. So in essence, we are working towards leveling the playing field so that all patients have access to the highest quality of care as it relates, in this case, to evaluation of abnormal findings on chest imaging. There's a long way to go. The algorithms continue to be developed. The platforms continue to improve, and we can expect that over time there'll be more and more validation of the accuracy and the impact of these tools on patient care. And the implementation will be done in a manner that is safe and effective for patients. So we have to go in a stepwise fashion, and we implement these new approaches in a way to minimize the risk. So many centers will use AI algorithms as a second reader. We are not replacing a radiologist, we're just providing the radiologist with another opinion, if you will, at the time that they're interpreting a scan. That is a very safe and likely effective strategy to evaluating the impact of these tools on improving patient care. We have an example at our medical center that I presented the other day. We talked about how we've implemented an AI package that will evaluate every single CT chest angiogram study that is performed to rule out a pulmonary embolism. Sometimes pulmonary embolism is difficult to diagnose on a chest CT scan. And so in our algorithm that we use from the company called AI Doc, every scan is evaluated and the algorithm will determine whether or not a pulmonary embolism is present on the CT angiogram study. What happens then is that CT scan is moved to the top of the pile of all the studies that our chest radiologist needs to read. And in many busy hospitals, there are many studies to read, and they get read in the order they come in. But here, this is a triage, so that the study that is positive on the AI goes to the top of the list, so there's a shorter time to make the diagnosis if the radiologist concurs. The final decision is made by the radiologist, so this is used in a safe manner as a triage tool and is going to be effective in reducing the time it takes to make a diagnosis and treat a patient with pulmonary embolism. Yeah, the issue of false positives comes up all the time, as it should. It comes up if we're talking about biomarker tests from the blood or biomarker tests from clinical questionnaires or biomarker tests from imaging studies. There always are going to be false positives and false negatives. The key is how you use the information that comes from the test to impact the care of the patient. So there's never going to be a test that's 100% perfect. We just need to know what the accuracy is of the test, and then that can help us to guide the management of the patient with the results that we get from the test. Well, it was a pleasure to participate in the China Innovation Summit that was held on Saturday. And what we all agreed on is that the diseases that we focus on do not respect borders. They do not respect political disagreements. Those are irrelevant. A disease like lung cancer is the same, whether it occurs in a patient in China or the US or Russia or Ukraine. So we need to have laser focus on being able to help patients with these diseases wherever they may live. Our ability to do that comes through the types of international collaborations that we have at this meeting, that we have in other settings to share research, to share our learnings, to share our patient experiences, so that we can do a better job of attaining that goal of leveling the playing field so that patients all over the world have the same opportunity to have a longer and better life.